Hello class and welcome to another exciting facilitation for this semester. I am Dr. Annie George, Department of Public Health, Faculty of Health Sciences, and will be your guide. Hope we all enjoy it. Thank you.
Hi students and welcome to another discussion class on PHS 311 Child Health. Last week we looked at topic 1, growth and development of a child. We looked at the differences between growth and development, which are usually people interchange them in a wrong way. We also looked at the aspects of child development as well as the stages of child development. So on topic 2 today, we will be looking at assessment of a newborn and common problems after birth. So at the end of the lesson, we should know what the major elements of assessment of a newborn are, understand the common problems that also newborn face. In assessment of a newborn, there is a particular element that you look at in assessment of newborn. It's called an APGAR score. APGAR score that was developed by an MD in 1952. The MD's name is Virginia APGAR. This test is performed on babies at the first minute of birth and 5 minutes after birth. The first minute actually looks at the significance of the first minute check is to see how a baby is tolerating the birthing process, and if the baby is not, resuscitation might be needed. Then the 5 minutes check looks at the survival strategy of this baby, if this baby is able to survive outside the womb. So what are the components or the elements of the APGAR score? There are 5 components or 5 elements that are usually looked at or checked at birthing of a child, and that is looking at the breathing effort, the heart rate, the muscle tone, reflexes, and skin color. So the breathing effort, heart rate, muscle tone, reflexes, and skin color, those are the things you check when you are doing an APGAR score or APGAR test. So how is APGAR scored? How is APGAR scored? Now, each category of those elements I listed earlier in the other slide, which is the breathing, the heart rate, reflexes, muscle tone, and skin color, the 5 of them has maximum score of 2. It's usually from 0 to 2. Each has 0 to 2 maximum score. So when you score maximum 2 to 2 to 2 on each of the 5 elements, if you multiply it by 5, 2 by 5, you have maximum combination score of 10. Now, when you add all of them after checking the 5 elements and scoring, and the score is less than 4, it shows that that baby is in a critical condition and requires resuscitation. Such score of 4 and less usually has tendency for babies coming down with one disease element after birth or even death. And when the score is between 4 and 6, is usually a cautious score between 4 and 6 and requires help. Such baby might require help like clearing of the airway, might need oxygen therapy so that the baby can breathe well. Then if the score is between 7 and 10, is considered a good APGAR score. So breaking down those elements, the 5 elements and how they are scored, when you look at the breathing effort, if a baby is not breathing after birth, at the first minute or at the 5 minutes, you score 0. If the baby has slow breathing or the breathing is irregular, you score 1. But if the baby cries well after birth, you score 2. Now, the heart rate. If a baby has no heartbeat, you check with the stethoscope and the baby doesn't even have any single heartbeat at all. No lop dop sound from the chest on your stethoscope, it is 0. But if you count the heart rate and it is less than 100 beats per minute, you score 1. Usually, a baby's heart rate is usually more than that of an adult at birth. It's usually over 100. But if it is less than 100, you score 1. If it's over 100, you score 2. Now, looking at the muscle tone as one of those elements, what do we assess in the muscle tone? When the muscles are loose and fluffy, you score 0. When there's some element of tone in the muscle, when you check, you score 1. But if there's active motion, you can see the body of the baby moving, then you score 2. Then we look at reflexes. Checking the reflexes of the baby. If there's no reaction at all to reflexes, rooting reflex, sucking reflex, as the case may be, and all sorts of reflexes that you check in babies, and there's no reaction at all, you score 0. If there's a little grimace when you check for reflexes, you score 1. If there's grimacing and there's cough and there's sneezing, and then vigorous cry, you could hear the baby cry vigorously, you score 2. Then we'll come to skin color. If the baby is pale blue, baby is blue at birth, you score 0. But if the baby has the body pink, but the extremities like the hands and the feet are pale blue, you score 1. But if the entire body is pink, which is the ideal color of a baby, you score 2. So this brings us to the common problems after birth. What are the common problems of babies after birth? There are 3 major common issues with babies after birth. We have thermal instability, we have changes in blood glucose levels, and oxygenation. That's problems with oxygenation of the body after birth. We will look at each of them in turn. So, thermal instability. From there, what is actually hypothermia? Hypothermia. What is hypothermia? Now, hypothermia is a temperature below 35 degrees centigrade. Now, usually at birth, babies could have what we call thermal instability. Such thermal instability could result from what we call cold stress and fluctuations in temperatures after birth. And that could lead to hypothermia, which is the temperature below 35 degrees centigrade. And such condition is characterized by color changes, decreased activity. The baby tends to be, have low activity, unable to feed, and then there is always an increased respiratory rate. Changes in blood glucose level is the second one, which is one of the problems babies face at birth. And the commonest one is the hypoglycemia. Hypoglycemia simply means low blood sugar below the normal levels, and it is characterized by abnormal high-pitched cry. Baby cries excessively with high shrill sound. The baby could turn blue, that is cyanosis, and then the baby could have difficulty in breathing, which is apnea. There could be poor feeding. Baby could vomit, and then lethargy. The baby could be lethargic and could have poor sucking ability. So who are the infants at risk of hypoglycemia? Remember, infants are children who are less than 1 year of age. So who are those infants that are at risk of hypoglycemia? Infants that are born from diabetic mothers, infants that their weight at birth is more than 4.5 kg, and then infants their weight is also less than 2.5 kg at birth, they are prone to having hypoglycemia or low blood sugar. Infants that are born prematurely or post-maturely, they are born post-date. Infants with prolonged perinatal stress, during delivery, the mother undergoes obstructed labor or prolonged labor, and exposing the baby to unnecessary stress in the womb before the baby comes out, that can make such an infant be prone to hypoglycemia. Then a baby that is infected, that has sepsis after birth, is also prone to having hypoglycemia. Then some babies that have endocrine and metabolic disorders also are prone to having hypoglycemia. So this brings us to oxygenation, which is the third part of the problems babies face. Now, usually after birth, a baby seems to have swallowed what we call the serum fluid at birth. Passing through the birth canal, the baby swallows some fluid after birth. This swallow of fluid is usually worse when there's a C-section, when a baby is delivered through cesarean section. So it is the duty of the medical expert or the health professional to clear the airway, suck everything out, and replace it with air. Such a baby could come down with cyanosis after birth, which could last for a few minutes. However, if the blueness of the baby becomes persistent, which is the cyanosis after 2 hours, we'll term it as central cyanosis. And such a baby requires oxygenation and is a very bad sign after birth, after all. So in summary, we've looked that test as a major element in assessing the newborn. We now know the common problems also associated with newborn, like hypoglycemia, hypothermia, and poor oxygenation, and the reasons why they experience all that, and the risks, babies that are at risks of having hypoglycemia. So in our next lecture, we will look at nutrition in children 0 to 5 years. Thank you for listening.